Understanding fetal heart stoppage, common causes.
Hello everyone. Today, we're going to dive deep into a significant topic related to pregnancy, the most common causes of fetal heart stoppage. This topic can be quite complex and sensitive, but it's essential to understand, especially for expectant parents, healthcare professionals, and anyone interested in prenatal health. Remember, this information is meant to provide general awareness and should not be used as a replacement for professional medical advice.
What is fetal heart stoppage?
To start, let's clarify what we mean by fetal heart stoppage. This term refers to a situation where the heart of a developing fetus stops beating. This can occur at any time during pregnancy and may lead to miscarriage, stillbirth, or neonatal death, depending on the gestational age. The cause of heart stoppage can vary widely.
What are the most common causes?
There are numerous causes for fetal heart stoppage. Let's discuss some of the most common ones. 1. Chromosomal or genetic abnormalities. These are one of the most common reasons for early miscarriages. Chromosomal abnormalities occur when there are missing or extra chromosomes or when structural changes to the chromosomes have taken place. These changes can affect the development of the fetus, including the heart. 2. Structural heart defects. These are problems with the physical structure of the baby's heart. They can range from simple issues that don't affect the baby's life to serious defects that require immediate attention after birth or lead to heart stoppage during the prenatal period. 3. Infections. Certain infections in the mother can lead to fetal heart stoppage. These can include infections like rubella, cytomegalovirus, toxoplasmosis, and others. 4. Placental complications. Problems with the placenta, such as placental abruption, where the placenta detaches from the uterine wall, or placenta previa, where the placenta covers the cervix, can interrupt the supply of oxygen and nutrients to the fetus, causing heart stoppage. 5. Maternal health issues. Conditions like diabetes, hypertension, and autoimmune diseases in the mother can also lead to complications, including fetal heart stoppage.
Can fetal heart stoppage be prevented?
While not all causes of fetal heart stoppage can be prevented, there are steps pregnant people can take to minimize the risks. These include regular prenatal checkups. Regular visits to the healthcare provider during pregnancy can help monitor the health of both the mother and the fetus. Maintaining a healthy lifestyle. This includes balanced nutrition, regular exercise, avoiding smoking, alcohol, and drugs, and managing stress levels. Getting vaccinated. Vaccinations can protect against certain infections that could potentially lead to fetal heart stoppage. Pre-existing conditions management. If the mother has pre-existing conditions such as diabetes or hypertension, managing these with the help of a healthcare professional can reduce the risk. In conclusion, while fetal heart stoppage is a significant concern during pregnancy, understanding the common causes and ways to mitigate risks can lead to safer pregnancies. If you're an expectant parent, make sure to communicate regularly with your healthcare provider and take care of your health. Remember, this video is meant to raise awareness and should not substitute professional medical advice. Thank you for watching and take care.